Hello, my name is Naprat Shudi, and this is Sasha Bias. We are talking about evidence-based practice about deep vein thrombosis. First of all, what is deep vein thrombosis or DVT? DVT, also referred as venous thromboembolism. It is a blood clot or thrombus which occur in a large deep vein in the body, usually in the legs or pelvic area. Now, the case study that we're going to start today is a shift complaint. Patient A present to the OR room with a broken left leg, which occurred while working. She is 48 years old, white female with a history of smoking and alcoholism. She's also present with the medical history, which include obesity, hypertension, strokes, and high cholesterol. She is currently on lisinopril for hypertension and atorvastatin for high cholesterol. In the OR, the procedure is explained by the surgeon and the consent was signed. As per stage 1, patient A is in the OR for a repair of the left fracture femur. Her vital sign is temperature is 98.2, heart rate is 102, oxygen saturation is 98%, blood pressure is 160 over 90, and respiration is 20. Objective, patient is prepared for the operation, and the subjective is patient state that she is kind of anxious about her surgery. Now, stage 1 intervention is related to preoperative interventions, which is included TED hose or sequential compression device or SCD. Position patient A for surgery, which is we need to avoid reverse Trendelenburg. And we also need to ensure patient's airways, which is part of the patient safety. The question for the stage 1, what factor that place patient to be at risk for developing DVT, and what were the preventative measures to perform in the preoperative phase for DVT prophylactics? The answer for stage 1 is that patient A present with long bone fractures, the history of smoking, obesity, alcoholism, and she is over 70 years old with cardiac disease. As evident by her history of hypertension, she is having surgery with the anesthesia. The TED hose and SCD and proper positioning for blood flow is to prevent the DVT.
In the recovery room, the patient presents with increased swelling to the left calf with pain and tenderness. The nurse measures the calf muscles and gathers vital signs. The left calf is about 4 centimeters bigger than the right calf with erythema. The current vital signs for this patient are the temperature is 99, so low-grade fever, the pulse of 97, blood pressure is 88 over 60, so she's hypotensive, oxygen saturation is 93. Respirations are 28. The tests that we want to do, ordered by the physicians, are the D-dimer, the diagnostic blood test that measures a substance that is released as a blood clot dissolves. Ultrasound, the Doppler, uses high-frequency sound waves to show the large veins in the leg and any blood clots with those deep veins. Venography. A liquid dye is injected into the veins to highlight blockage of the blood flow by a clot on an image of the legs. The most accurate test, but also the most uncomfortable and invasive. We can also do a CAT scan, a type of X-ray that gives a very detailed look at the leg veins in cross-section and can detect clots. Last one, magnetic resonance venography. Very accurate, but usually only used for patients in which venography is ordered, but the patient has allergies to the contrast dye. The stage 2 interventions include interventions. You must notify the MD with the current signs and symptoms related to a DVT post-surgery. Once you receive the MD orders of D-dimer, Doppler ultrasound, CAT scan, or magnetic resonance venography, you must implement those orders. Then you must review the results. Initial PTT has to be collected. You have to weigh the patient, and you must initiate heparin drip as per protocol. There are questions that we do have for stage 2. What clinical manifestations did the patient present with? What lab work should the doctor include? The answers are as follows. shortness of breath, increased swelling of the left calf, pain and tenderness of left lower extremities. And you must obtain labs of PTT, INR, and CBC. Stage 3. Patient has been on the heparin drip for about 3 days, and she has reached a therapeutic PTT level. Coumadin therapy has begun, and you must prepare the patient for discharge. You do assessment and you obtain labs. Vital signs are as follows. Temperature of 98.4, pulse is 82, blood pressure has gone down now, it's 128/65, oxygen saturation 97, respiration 16, INR is 1.2, PTT is 33, and decreased pain and swelling of that left calf. The interventions are, you must provide a patient with Coumadin teaching and diet, recommend lifestyle changes as she is obese, and follow-up instructions and discharge teaching. The questions are, what should the nurse emphasize for Coumadin teaching? What are some lifestyle changes that the patient can work on? And what is the common complication of DVT? The answers are as follows. Coumadin teaching, check for signs of bleeding and avoid green leafy vegetables that may interfere with medication effectiveness. Lifestyle changes, do not sit for long periods of time, keep hydrated, drink 6 glasses of water a day, lose weight, smoking, alcohol cessation, and just get up and exercise. Pulmonary embolism, PE, life-threatening and potentially fatal. When embolism dislodges from an artery in the legs or pelvis to a lung artery. Pulmonary embolism, what are the common signs and symptoms? Shortness of breath, that nagging cough, coughing up blood, sweating, sudden chest pain, a feeling of doom or apprehension. Make sure you call 911. Here are the references that we used, and they're listed in alphabetical order. We want to thank you so much for watching our presentation.
Thank you.